G'day, how's it going? My name's Gus and this is my Osce. So today we've been called to an apartment block to visit my patient George. George is a fit and healthy young man, and his flatmate has called us as when she has come home she has found George on the ground. She ascertains that George has been there for around about 4 to 5 hours. Upon arriving, we take George's vital signs, which come back varied. What my main focus of this is going to be is to first ascertain why he's on the ground, whether it's a mechanical or medical fault, and then I can start ruling out medical emergencies such as stroke. How's it going?
Not so great, to be honest.
Cool. My name's Gus, I'm with St. John.
Hi, Gus.
Do you know why the ambulance has been called today?
Well, I believe it's because I've somehow fallen over and landed in this position.
Land in this position, okay. Do you have any pain anywhere?
Yeah, to be honest, my whole upper legs
that's alright, just yourself.
In agony.
Alright, can you flatten your leg down for me?
I have difficulty. There we go.
Alright, perfect. Okay. How long ago did this fall happen?
To be honest, I can't really remember.
Can't remember?
I don't know how long I've been here.
Well, the person that called us said that it happened over 5 hours ago, right?
Shit.
Okay. So you've been on the ground for quite a while.
Yeah.
Okay. First of all, since I found out the stroke that the fall was over 5 hours ago, I don't have to worry about a stroke because any stroke that may have occurred has already irreversibly damaged George, and so now I no longer have to rush through my patient assessment or treatment. Alright, so George, do you have any idea how you might have fallen?
Well, I mean, not really. Like, I was just, one minute I was like walking to my room, next thing you know, I'm like on the ground, I can see this bloody thing here, so I might have like tripped over that or something.
You may have fallen onto that,
Yeah.
okay? So George, I'm just going to have a quick examination of you, okay? So upon looking at George's leg, I can see a stark shortening and rotation of his leg, his right leg, in comparison with his left leg. There's no obvious bruises, scars, scratches, cuts, or varicose veins on his right leg. However, there is a significant amount of red swelling that's occurred to his upper thigh, without removing his modesty.
You can do it, it's alright. Not a bit left.
Cool, so right now what I'm going to do is I'm going to move through my 6 P's of the skeletal-muscular assessment. I believe that George's accident has resulted in a mid-shaft fracture of his femur, with my differential diagnosis being a Knopf fracture or a dislocated hip, a Knopf being a neck of femur fracture. The reason why I suspect it's been a mid-shaft femur fracture is due to the obvious abnormalities, the amount of pain he's experiencing, and also the subsequent swelling. After administering my pain relief and treating George's obvious sign of his broken leg, what I want to do is move into how this fall actually occurred due to the fact he has no recollection. So George, I just want to focus on the reason why you actually had the fall today, just to rule out any medical conditions. I want to make sure this was mechanical rather than medical.
Right.
Okay? So you don't remember falling?
No, like,
No
recollection whatsoever.
Yeah? You don't remember how long you were out for?
No, I mean, it honestly could have been any time, but you said it was 5 hours. So.
Okay, George, what I want to do is I want to rule out signs of a stroke, okay? I just want to make sure that wasn't something that happened, okay? So what I'm going to get you to do is just give me a big, broad smile. Yep. Perfect. And I want you to give me a puff out your lips, like this. Perfect, cool. George has got nice equilateral facial features on both sides, so his face is not drooping in any way, which is a sign of stroke. Cool, George, what I need to do is with both hands, I want you to grab onto my fingers.
Like so.
Cool. And I want you to squeeze as tight as you can. Okay. Nice. George has nice equilateral strength in both arms. Alright, keeping your hands there, George. Okay. I want you to close your eyes, okay? And when I say let go, I want you to keep your arms exactly straight like you are now.
Okay.
Let go of my hands. Alright, let go. Your arms there. Perfect. George's arms aren't drooping or slooping in any way. Okay. And they are absolutely equilateral and fine. Okay. So after ruling out both his facial features, no drooping there, his arms, no deviation in his strength or any weakness there, okay? His speech, he is speaking very normally to me, and from what I've been told by the person that called, he is speaking absolutely normal for him, and time is not an issue, okay? George, I'm just going to ask you a few wee questions just to make sure there's no amnesic symptoms associated with your fall, okay?
Right.
Perfect. So do you know what month it is today, mate?
It is April, just.
It's just April? Perfect. Do you know what year it is today?
It is 2018 or 2018 if you're that way inclined.
Who's our current Prime Minister?
Oh, Jacinda the babe.
Jacinda the babe?
Yeah.
Well, she is having a baby, correct.
Oh,
I can definitely rule out any amnesic symptoms from that little test. He seems absolutely fine. Cool, George, what I'm going to do now is just do a little coordination test, alright? So what I'm going to do is I'm going to hold my finger out like this. I want you to put your finger on your nose.
Right.
Okay? With that hand and that finger, I want you to bring it from your nose and touch my finger and then bring it back, okay? You're going to do this 3 times on each hand.
Okay.
Alright, so touch my finger, bring it to your nose. Touch my finger, back to your nose. Touch my finger, back to your nose, okay? Other hand. Finger, back to your nose. Touch my finger, back to your nose. Touch my finger, back to your nose.
Nailed.
Perfect, George. I think your coordination is absolutely spot on there, okay? So I can't see any reason why coordination would have been the cause of your fall. Okay.
Cool.
Have you ever had a fall like this before?
Yes, I have.
Yeah? Okay.
Yes.
Do you know why that was?
I think my doctor said something once about having like a syncope. I think that's how it's pronounced.
Syncopes, okay.
Yeah,
Does this
that
happen
thing.
quite often for you?
Like probably more regularly than I'd like, to be honest.
So quite a lot, okay. So due to your bounding heart rate and your high blood pressure, okay, and the fact that it is quite a hot day, you're 38 degrees temperature, okay.
Buckets.
I do think that might have been the reason. A syncope would have been the reason for your fall today, mate. Okay.
Okay. Yeah.
Is there anything else that might have contributed to this?
Maybe having a bit too much to drink last night, but I'd rather go with the syncope, to be honest. It's not my fault.
So I think the main reason for this could actually be due. You're actually watching Dancing the Stars right now.
Yeah, or maybe it's just the excitement of seeing old Robert.
Listen, you need to be seated when you're watching Dancing with the Stars, okay?
Okay, I just try to like emulate their moves.
George, listen, I don't want to be the one to give advice, but you just need to be seated while watching Dancing with the Stars.
Okay, fine.
How's David Seymour doing? Man, the guy's a good dancer.
Oh, hey, g'day, how's it going? So, during my care of George, first I felt that it was necessary to firstly eliminate the possibility of a stroke, and this would decrease my urgency and need to get into a hospital fast. Once I was informed that the fall occurred over 4 hours ago, I decided to take care of George's main complaint, which was his leg. Focusing on diagnosing this and treating this with appropriate analgesia would make my job easier, questioning him and finding out the causes for his fall. Due to the swelling and intense pain in George's leg, it was clear that something was quite wrong. The abnormalities, such as the rotation and the shortening of his leg, pointed to a mid-shaft femur fracture, which is one of the most common fracture included in these symptoms. My differential diagnoses, as I said before, were a busted hip or a dislocated hip. Upon investigating the reasons for George's fall, I concluded that the fall was by a medical cause, as George had no recollection of his fall and has a history of syncope, and his vitals on the night were a heightened temperature and higher blood pressure. These symptoms, alongside a sweaty and riveting episode of Dancing with the Stars, I could most certainly point to a history of syncope being the main reason for his blackout. I managed to rule out cardiac problems with an ECG, and that came back clear. A fast test also showed no problems and no signs of stroke, no signs of drug or alcohol, could smell nothing and there was nothing around, and a normal blood glucose level again ruled out a hypoglycemic event.